My name is George Swan. We're going to talk about hospital benchmarking today. We're going to use an example of patient satisfaction database from the USA, and it's the best example of patient data that I can think of. All 4,600 hospitals in the United States are in this data set, and we're going to access it in the form of a pivot table. This is part of a larger hospital performance benchmarking presentation, and we're just going to look at this example as a very good way for countries around the world to be able to make data available to stakeholders, hospitals that want to compare their results to other hospitals. So one of the questions, we have all these hospitals and clinics are part of a big healthcare industry. They're part of regions, cities, communities, part of countries that need to upload data from hospitals and physicians to look at how everybody's doing. And you can't report to WHO unless you consolidate this data, unless you get the data in a routine way. I've looked on the websites, and frankly, it is very hard to get this data from most countries that I've been to. A hospital is involved with patient engagement. If you look over here on the right, this little triad: patient engagement, employee engagement, community engagement. And you cannot be doing these things appropriately or properly or well unless you have data to work with. You have a good foundation of a system for collecting data, tracking data internally. Only if you have data that you can use internally can you then begin to look at hospitals and understand the results that they have. And then you have to pick which hospitals do you compare to. But the stakeholders are interested in comparing one country against the other. And that requires collecting data, having a systematic way to do this. So this is some data that I've downloaded from World Health Organization, and you can see these are countries in the GCC where I'm working, in the United Arab Emirates, and we can compare the years, but frankly it is old data, and getting current data is very, very difficult. And also you can see the cells that are empty. We don't get complete information, and that just compromises our ability to really make use of what the data is telling us and pointing to, like an indicator. This is just to show you, in California, they have a very nice mind map and a lot of information. In particular, we've done another video to show how they can take their cost reports from 460 hospitals and make it available to people, but they don't do it as a pivot table. And so we've done a demo about California data to show how nicely pivot tables are to use, and anybody can use a pivot table if they just have fundamental data sets to work with. So that's another video. I also downloaded data from Ohio State. They have a nice data set on all their hospitals, but these are just individual states. But if you go to Colorado, for example, you can't get the data from Colorado in any way that I've been able to find, whether you go to the public health site or you go to Colorado Hospital Association or some of the other sites. It's just not available as side-by-side hospital comparison benchmarks for this patient satisfaction information. So what I did find, and I'm just not a business intelligence expert, but I did locate this site, and I realized after a little bit of work what a flat file is, a comma delimited file. You can download an access database, and I'm going to show you what you get when you go to this site. Okay, we're just going to get out of this PowerPoint. We're going to go and click on this, and you can see that what I have are Excel comma delimited files, but 48 million megabytes of information. This is about the questionnaires. They call it HCAHPS, patient satisfaction that every hospital in the United States uses for discharge patients. And that data is available for 2013 right here. There's other information about healthcare-associated infections. I've done another YouTube about timely and effective care in a hospital. And this one, we're going to concentrate on the patient satisfaction question. So let's just double-click on that and see what we get. And what we get is this comma-delimited file. Now, unless you are used to working with Excel, you are not going to be able to do a lot with this information. So you'll give it to somebody who's a business intelligence expert, a BI expert, and they would be able to say, okay, what can you do with the data? So whenever you get a flat file like this, the first thing you want to go to is this format as a table. Now, for many, many years, I've gone to insert and I've gone to pivot table, and it just does not have the same features as if I format it first. So I'm in home, I go to format, I click on there, and I just highlight this, and I immediately get these table tools. I get the headers at the top, so that if I scroll down to the bottom of the data, there's 147,000 lines, answers to these questions. Then the header just stays at the top. You can see what the data is underneath it. It also has a little drop-down button, so if I wanted to, kind of pull out the Colorado information, for example. I'm from Colorado, so I could do something like that, and then I go back and I could open up this data set like that. And the next step that I would do is just make a pivot table. All right, so I go to this summarize, it pulls out the table for me, I click on OK, and I immediately have a framework for a pivot table. Any of you who have not done pivot tables and you're kind of afraid of the word, it's sort of scary, like, oh, I don't use Excel that much. Try it, you'll like it. That's all I can say. And I'm going to show you how a pivot table works, and I hope you'll give it a go. And if I go to the HCAHPS questions, for example, and I list it, then all the questions, there are 10 questions, they're listed right here. And just like that, I can look at them, and here's an answer in a percent format. I go over and click on that, and it gives me this. Let's say I just type in AVG. Sorry about that. So that's going to be AVG. And I'm going to double click on this, bring me back into the picture. Now, what have I got here? I have a count of all the results, and I don't want a count. So I go to the value field settings and I pick average, and I like to go to the number format, go up here, and I know that the percentage is a whole number. So I'm going to click on 0 and click on this, and again I've got the average coming in here. So there we are with the average of 4,600 hospitals in the United States. 51% of the patients strongly agree that they understood their care when they left the hospital, which is not good, and we need to do better on that. Now, 43% said that they did agree, and that's sort of they agreed, but there were 5% who disagreed or strongly disagreed that they understood their care. If we go down to the bottom, we have this, yes, they would definitely recommend the hospital. 71% said they would strongly recommend the hospital. That's considered the gold standard question. I like to highlight this information like this, just give it a border, and just show you a couple other things you can do with this. So if I put in a select field down here in the report, so I could pick, if I'm from Colorado, I could pick Colorado, just click on that, and this is the choice for the average for all the hospitals in Colorado, just like that. And I could click into California. If I'm from California, there's the average for the California states. That's pretty good just as it is. But this is a select drop-down button. If I'm, kind of looking for, let's see, where's Hawaii, right? It takes a little bit of time to kind of learn that. But there it is. I click OK, and there's the average for Hawaii. I want to show you something that's a little bit more useful. So the first thing I would do is click on here, and I'd say click all. In fact, I'll take the state out of that, and whenever I'm in a pivot table, I go to these pivot table tools up here, and it has a function called insert slicer. So if I click that, and I have a state, and I have a county, and I have the hospital name, something like that, right? I click on that, and now I want to open up just a little bit of space at the top for this. And I like to put my state like over here somewhere. I'll close this up so it won't block when I'm reading these questions. So next would be the counties, and next would be the hospitals. And what's nice about this, it's a little bit tricky. I'm glad this is happening because your executives don't have time to do all this stuff. You're going to have to prepare a pivot table for them. So what's nice about this, if I go back to Colorado, it'll automatically put the counties in Colorado at the top. So I could very quickly go to, Denver, and now this is the average for Denver hospitals. And if I wanted to see a particular hospital like Denver Health, that's the results from Denver Health. Or if I want to look at Centura Health, something like that, that is pretty cool. And if I want to go back to the average of all the hospitals in the United States, I just deselect the hospitals, deselect the counties, and deselect all the states, and now I've got the average for every hospital in the United States. I like to give a little name to my pivot table. I'll call it Pivot Table 1. Let's call it just All USA, something like that. Now, because I've done all this work, I can actually just copy this. I want to create a different kind of pivot table, so I'm going to put that in here, and now I'm going to call this Pivot Table 2, and let's see, here we are. Whoops, something going wrong here. I don't know what happened to my numbers there, but sometimes this is a little funny sort of thing. Let's call it A. So pivot table, or B. So there's pivot table B, and this is going to be a comparison, and I want to compare states, something like that. Okay? And so if I want to compare states, I say, well, I want to look at California. I want to compare Colorado. I control click, and maybe I control click Arizona as well. But in order to see them side by side, I have to take my states and I have to put them in the column. There's my side by side comparison. So if I want to come down and I want to look at, say, Hawaii, I control click on Hawaii, and now I have whatever states I want to compare. If I deselect, I actually can see every state in the union side by side. How neat is that? Now, what's also interesting is, so that's comparing states. What if I wanted to compare the counties? Well, let's say I did something like this, and I create a copy, and I go into this. So instead of B, this is now C, and I'm going to compare, let's say, counties, something like that. And I click on, now again, I go back to Colorado, click on that. These are the counties, and I want to compare, let's say Denver County against Boulder County. It would be control click, and maybe Eagle County. Oops, be careful. Be sure you have the control click. So control click, well, again, where are they? Well, I have to take the state out, and I'm going to put the county name into the column. And there's Boulder, Denver, and Eagle County. And, if I want to look at these side by side, I'm going to highlight my whole area, set the print area, come up here, and again, executives don't have time to do this, so the secretary could do it just as easily. If people learn how to do a pivot table, it'll already be set up, most of them, but sometimes you want to make it yourself. So it's worth learning these skills. But there's a nice report of Boulder, Denver, and Eagle counties side by side, their averages, and I could do this for any county in Colorado, or for that matter, any state of the union. If I want to compare a county, maybe Los Angeles County is more comparable to Denver, so I could select those counties side by side and make a nice printout. If I was a BI department in a hospital, I could print this out for the executive, and they can work with the results. That's the end of the game, is to give them results quickly and easily that they want to see. And then lastly, again, if I just create a copy for this, click in here, this is now going to be, let's say D, and it's going to be a compare. Sorry, it's going to be compare, but now I want to compare hospitals. So I click in there, and again, here's, let's say I deselect the counties. I have every county in Colorado is side by side, but I just want to look now at Denver. I have all these hospitals. What do? Again, take out the county, and I'm going to put the hospital name in the column headings. Now, these names are pretty wide, so if I just highlight the columns and narrow it down a little bit, now I've got these hospitals, all side by side. I click in here, set the print area. I've got a pivot table result of all the hospitals in Denver County. I could do this for other hospitals anywhere in the United States. If there were hospitals in Los Angeles or hospitals in Washington, D.C. that I wanted to compare against my hospital, I could just select those side by side, no problem, and print it out for the people that need to look at this information. Wow, just takes your breath away. Now, that's all I'm going to do at this point on this result for a pivot table. But let's go back to this. I want to get just bring you back to this question of why doesn't the government create these basic pivot tables that I've just done and allow people to upload that directly and start comparing their hospital, their county, their state's information. It would be that easy to do. So if they did it, then their home site would probably look something like that. They've got access database. I can click on that and get an access. If I have a statistical application like SAS, I could click on that and I could bring that in. But if I just wanted to use a pivot table, I could click on a pivot table. I could look at all the pivot tables I have set up already. And there is a last little thing I should actually show you. If I go back to this result, it's set up as a CSV file, and we should actually save it as a I have a little folder here. If I go into my CMS, I can't save it as a CSV file. I actually want to save it as an Excel workbook, right? And it's going to be HCAHPS, and it's going to be, you know, again, all, sorry, shift all hospitals USA, and I'll just save it like that. And now it's an Excel file, and it's just keeps it. If I want to keep it on my network in the hospital to use it, I could do that. But if I downloaded this from the government and saved it, it would just be the same thing. So that's really what we're talking about, is why doesn't the government just do these pivot tables in advance and save everybody else all the trouble, and you know, you make everybody happy. Thank you very much, and that's the end of our video.